Hi, my name is Marcy Woolery, and I decided to do my comparison paper on the United States healthcare in Switzerland. Switzerland's healthcare system is considered one of the best in the world. This was stated in 2015. Broad generalizations such as this one are common when describing something as complex as a national healthcare system. Statements such as this one are typically made about things seen from the outside in. A resident in the United States is likely to view a visit to an urgent care clinic as evidence of effective healthcare delivery. As observer participants in our own healthcare, it is difficult to assign value on a single treatment individual, a series of treatments, preventative medicine to avoid any treatments, or paying for insurance that allows us to receive treatment. Unlike other products, our investments in healthcare as individuals, businesses, and as a nation carry tremendous meaning about our lifestyle, values, ethics, and moral judgments. Similar statements are made about the kind of car one drives, suggesting perhaps that a single person driving an H1 Hummer doesn't care about the environment or they're flaunting their wealth. I claim that there are many superficial comparisons that convey something about a person. However, healthcare is the largest consumer expense that is implicitly kept private and expresses our beliefs without bias. So the historical similarities and differences between the Swiss system and with the U.S. system. The Swiss system of government is based on federal and province systems with strong similarity to the separation of powers between federal and state government. Provinces are sovereign entities in as far as they are not limited by the federal constitution, identically in theory to state government with respect to occurrences within their borders. Unlike the United States, the Swiss government is culturally grounded around the direct vote that allows citizens the ability to directly affect legislation and process. This direct vote has the same power as veto or amendment, thus all legislation remains a living document throughout its life. In order to call for a vote or veto of legislation in progress, 50,000 signatures, which is 0.6% of the population, are required, and to call for an amendment on existing laws, twice that number. While Switzerland's healthcare reforms have kept pace with its European neighbors, it is typically excluded from healthcare analysis because of its population is less than 10% of Germany and political complexity of 26 sovereign provinces compared to 16 German states. While the United States legislation is absent any form of direct vote of the autonomy of the Swiss people with respect to the federal government is much more similar to that of the U.S. federal and state system. So there are milestones in public health. In Switzerland and all of Western Europe, an epidemic of healthcare reform started in the late 70s. The U.S. healthcare system has undergone the most significant transition within the 21st century. Two pieces of legislation that have virtually no impact on healthcare consumer, but are the major driving forces in the healthcare industry, are the Health Insurance Portability and Availability Act, HIPAA, and the Health Information Technology for Economic and Clinic Health Act, HITECH. HIPAA was passed into law in 1996 and HITECH was passed in 2009. However, the substantial penalties for HIPAA violations were not enforceable until the final rule made them enforceable in 2006. Unlike HIPAA, HITECH was not a standalone bill, one component of the American Reinvestment and Recovery Act of 2009. So the purpose of HIPAA was so that it allowed employees to change jobs without fear of losing their employee-sponsored coverage. As the healthcare system incorporated patient portability into its structure, HIPAA has become the de facto privacy standard for all medical information. High-tech legislation was written to promote adoption of new technologies such as the electronic health record and investment in new technologies to improve the quality of healthcare delivery, reduce the cost, and improve patient experience. HITECH incorporates new authorities that penalize medical service providers receiving Medicare and or Medicaid scheduled payments that have not transitioned to an EHR system. Significantly, HITECH legislation mandates EHRs for all persons, not citizens, within the United States and coordination between the Department of Health and Human Services and other sovereign nations. This milestone was codified by a memorandum of agreement between the HHS and the European Commission regarding the use of information communication technologies in December of 2010. The biggest milestone in healthcare was the Affordable Care Act of 2010, which mandates that all U.S. residents above a certain income level must have health insurance, either out of pocket through an insurance marketplace, an employer, or Medicare, Medicaid. Prior to HIPAA, individuals could be refused coverage if the insurance company deemed them to be a bad investment due to pre-existing conditions. This translated into receiving health insurance through an employer as the primary means of securing sufficient coverage. Losing or changing jobs meant dropping one's health insurance. In the current marketplace, denying coverage, dropping an employee's coverage when changing jobs is illegal, and refusing to secure health insurance increases one's taxes burden. Switzerland supported social insurance starting in 1912 with the sickness and accident insurance, then later added pensions, disability insurance, and unemployment insurance, revisiting the accident and sickness insurance separately in 1981 and in 1994. Outside the public's desire for an affordable healthcare system, the similarities between the two nations' healthcare milestones are poorly contrasted. The cultural gap rests squarely in Swiss's constitution that mandates universal healthcare. Unlike U.S. healthcare legislation, the Swiss people have amended their constitution to achieve the desired results. One interestingly commonality is the separation of dental insurance from other health insurance. Outside of routine dental cleaning, dental care is an individual responsibility. So there's three areas of the contemporary healthcare operations, which are the role of the consumer, the role of the employer, and the role of the government. And the impact on the public health is, according to Verisfall in 2012, healthcare is the most important sector of the welfare state and the second most important in terms of expenditures. In this context, this quote is less about the cost of healthcare and more about the perception of the country being a welfare state. Whether it is the pioneer origins of the United States, the long history of national isolation, or the mentality of pulling oneself up by the bootstraps, have a profound impact on government willingness to legislating public assistance and the public's appetite for taxes that support such programs. And the use of health information technology, the United States has been the leader in the development and application of technology since the information economy started. The United States is the most heavily invested Western nation in information and communication technologies for national infrastructure. The passage of the HITECH Act codified the need to inject existing technologies into the healthcare system that is in need of substantial efficiencies in terms of cost saving, elimination of redundancy, reduction of fraud, and increased privacy. The HITECH Act empowered U.S. agencies to incorporate requirements in relevant federal contracts, penalizing medical practitioners receiving public funds that refuse to adopt EHR technology and incentive payments for early adopters. Under the Transatlantic Cooperation Agreement, Europe as a whole is working towards similar goals. The primary difference between the the two initiatives that pervade every European collaboration is overcoming the barrier of language. Under high tech, the Secretary of HHS is charged with creating an EHR for every U.S. resident by 2014. So, in conclusion, one of the chief questions when asked about healthcare is, what is the cost? The answer is different depending on whether the answer comes from the government, an employer, or an individual. There's ample evidence that the cost of healthcare is high at a national level. The cost of healthcare for the average U.S. customer is about 5% compared to the 4.4% to 16.4% of their disposable income for health insurance for the Swiss customer. Both nations treat healthcare differently than other commodities, and their cultural interpretation reflects it. Despite the size of Switzerland, it has the political complexity that is reminiscent of the United States than of its neighboring countries. While the Swiss Constitution was modeled after the U.S. Constitution, the Swiss citizen has as much more active role in the application of direct democracy. Social welfare began in both nations in the 1900s, but the robust health care reform spread across Europe in the late 70s. The United States remained the only Western nation not to offer universal health coverage to all its citizens. The U.S. initiated health care reform in 1996 that was recognized by the American Medical Association as being similar to the Swiss system. The U.S. healthcare system has recently been dominated by growing concerns for privacy, electronic data theft, and the severe penalties that are now aggressively enforced. The mature Swiss marketplace is focused on delivering better, more competitive products to lure an informed audience. The U.S. customer is transitioning from an employer-dominated group insurance to a marketplace of choice. Simultaneously, the healthcare industry is striving to adapt to new technology requirements, greater regulation, and oversight, and remaining competitive. The Swiss system is less costly on a national level and has a greater marginal utility dollar per dollar than the U.S. system. That's it. Hope you enjoyed it. Thanks.